Hello, I'm Sylvia Azania, and we are going to talk about the quality of eggs for an IVF treatment. First, we are going to see if the quantity and quality of eggs are the same. We are also going to see what a normal egg looks like and what alterations it may present. And we will also talk about the causes of a poor egg quality. Furthermore, we will take the time to answer some of the most frequently asked questions that users may have in relation to this topic. One point that is very important to clarify is that egg quantity and quality are not the same. The ovarian reserve of a woman, that is to say, the number of eggs, is already established at the moment of her birth. Approximately, girls are born with a number between 1 and 2 million of immature eggs. However, when they reach puberty, the ovarian reserve has already decreased to about 500,000 oocytes. From this point forward, a woman will continue to release one mature egg during each menstrual cycle. However, other eggs will undergo a process of atresia and will be lost. With all this, the ovarian reserve of a woman decreases as time goes by until it is completely depleted by the time she reaches menopause. However, not only does the number of eggs decrease with age, but their overall quality also tends to decline. As you get older, it's more likely that your eggs will develop chromosomal issues. This means that embryos may develop with chromosomal issues or abnormalities, potentially leading to miscarriage or even the birth of a child with a health condition. Therefore, even if a 40-year-old woman has a good number of antral follicles seen on ultrasound, meaning she has a good ovarian reserve, it does not mean that these eggs are of good quality. The age of the woman is crucial for ensuring the eggs are of good quality. Starting at approximately 35 years of age, the eggs tend to be of lower quality and their quantity decreases as well. And before continuing with the content of this video, I kindly ask you to like it and subscribe to the channel if you haven't done so yet, because your support helps us immensely to keep going and allows our information to reach a wider audience. Determining egg quality is not a simple task. Nevertheless, during IVF treatment, it is possible to evaluate the morphology of the eggs through a microscope. However, these structural alterations that can be observed under the microscope do not indicate or provide information initially about whether the egg has chromosomal alterations or not. In any case, let's take a closer look at what the appearance of a normal oocyte would be like and what types of oocyte dysmorphisms might possibly be found during its evaluation. A normal oocyte must properly exhibit a rounded shape and, in addition, have all of its structures clearly defined. A homogeneous cytoplasm without any foreign bodies that attract attention inside it. There should be one polar body in the paravitelline space, which is slightly flattened and contains homogeneous material. A paravitelline space that is barely noticeable, only in the area where the polar body is located. And a uniform zona pellucida of adequate thickness. The presence of the first polar body indicates that the egg is ready for fertilization. These eggs are said to be in metaphase 2. As for the alterations, the ones we might encounter in the cytoplasm of the oocyte are the following. A granular content, refractory bodies, necrotic bodies, smooth endoplasmic reticulum and vacuoles, and cluster, a granular and dark area. Conversely, the changes that can occur in the oocyte related to the polar body include the following points. Multiple polar corpuscles, in other words, there is more than one. A fragmented polar corpuscle. And an amorphous or very flattened polar corpuscle. Regarding the paravitelline space, it is the area found between the zona pellucida and the oocyte itself. This should barely be noticeable, only hinted at in the area where the polar body is located. Therefore, the alterations related to the paravitelline space are as follows. A wide paravitelline space, or with irregular areas which are both wide and narrow. Presence of debris in the paravitelline space. In conclusion, the zona pellucida is the outer layer enveloping the ovum. This should have a proportional thickness of approximately 15 to 20 microns. The alterations that could be found in the zona pellucida of an oocyte would be the following. Amplitude too thick or narrow, lax or overly dense pellucid zone, irregular zona pellucida with areas thinner than others, partitioned zona pellucida forming like an independent section, and a long clear zone. These dysmorphisms can make it difficult for the eggs to be fertilized. Nonetheless, using intracytoplasmic sperm injection, ICSI, could allow for their fertilization. It is also possible that thickened, elongated, or partitioned zona pellucida may present significant problems for embryo hatching. This occurs when the embryo in the blastocyst stage detaches itself from the zona pellucida to implant in the endometrium. In such cases, the embryologist would evaluate the option of assisted hatching. Advanced maternal age is considered to be one of the main causes of a poor egg quality. Additionally, certain health issues and unhealthy habits may have a negative effect on the overall quality of the eggs. These include endometriosis, polycystic ovary syndrome, tobacco and alcohol, unhealthy diet, and treatments with radiation or chemotherapy. Thus, maintaining a healthy lifestyle is recommended, including good nutrition, moderate exercise, and avoiding harmful substances. Now, we are going to answer some of the most frequently asked questions users may have regarding this topic. How can egg quality be improved? Despite the fact that there is no miracle drug capable of improving egg quality, maintaining healthy lifestyle habits and following a balanced and nutritious diet can provide significant benefits for female fertility. Therefore, it is recommended to follow a diet that includes foods rich in vitamins, antioxidants, and essential nutrients, such as green leafy vegetables, for example, like spinach, nuts and similar dried fruits, lentils and other legumes, fish such as salmon, and fruits and vegetables like blueberries, pineapple, pomegranate, or carrots. Does the anti-Müllerian hormone measure egg quality? No. The anti-Müllerian hormone, or AMH, is an excellent marker of ovarian reserve, which means that it provides information about the number of eggs in a woman's ovaries at a given time. When AMH levels are between 0.7 and 3 nanograms per milliliter, ovarian reserve is considered normal. In contrast, if anti-Müllerian levels in the blood are below 0.7 nanograms per milliliter, ovarian reserve would be diminished. In this way, AMH provides information about the number of eggs, about the ovarian reserve, but not about their quality. We'd really like to know your experience, so please share it in the comments.